Right. Now, this is go through your case notes. Hello.
Good day.
Good day.
Yes, afternoon.
Yeah, can I call you after the session? I am in a session now.
Okay, sorry.
Right. Yes. So this is so now we are moving to the writing task. Okay. Now let us see here. Dr. A. Mole. That is number one. Emergency department. Number two. South Cottingham and Children's Hospital. Yes. So South Cottingham Children's Hospital. So now here there are 4 lines. You see Dr. A. Mole, Emergency Department, South Cottingham Children's Hospital. This is the name of the hospital. And it is there in South Cottingham. So 4 lines. 1, 2, South Cottingham Children's Hospital, 3, and South Cottingham. Right. Dr. A. Mole. Okay. So everything is ready, set. 196 words are there. Yeah. So here, till here. So 196 words are there. Fine, that's good. Very good. You have limited yourself to the Right. Review. Fine. So that is right. Dr. A. Mole. Fine. Emergency department or the emergency department, right? And South Cottingham Children's Hospital. Yes, CCH capital letters. South Cottingham. Very good. Excellent. And the date is 10 April 2013. Okay, 10 April 2013. Yeah, this is the last date. Okay, so you are writing the date there. 10 April. Yeah, fine. Okay, good. This is the date, 10 April 2013. Yeah, that is fine. So, dear Dr. Mole, that is enough. So, A is not needed. Dear Dr. Mole is enough. Regarding Kelsie Jennings, 10-year-old, no, 10 years old. Aged 10, you can just say aged 10, that is enough. Why we want all these things? Aged 10, 10 means 10 years. So normally aged is related to years. Okay. So just write regarding Kelsie Jennings, aged 10. Okay. Aged 10. So this is how you have to see. Right. Till here it's okay. 1, 2, 3, 4. That's fine. Next you can see here. So dear Dr. Mole, so yours is sincerely, this is also right. And here, okay, you are in your medical practice. So you can remember there. You can see here. So general practice. So you are a general practitioner. So you can write a doctor or you can write general practitioner. Okay. But so now we are going to the main body of the letter. Kelsie Jennings, who has been recently diagnosed with asthma. So, okay, recently you told. So, who has been? Then you have to say who has been recently diagnosed. Okay, Kelsie Jennings has diagnosed. No, Kelsie Jennings has been diagnosed. You have diagnosed. And Kelsie Jennings has been diagnosed. She is the recipient of the action. So, has been. Okay, who has been recently diagnosed with asthma, which lately, so you're telling here recently and here you're saying lately. How you can use that word? So that first recently diagnosed and lately exacerbated. How can that be possible? Okay. So better you use past tense here. Better you use past tense here. Was. Because you're saying past tense here, lately exacerbated. So this is already past tense. Okay. This is already past tense. So no need recently also. So Kelsie Jennings, who was diagnosed with asthma, which lately exacerbated by an upper respiratory infection. Okay. is being referred for immediate assessment and appropriate management. Okay. Kelsie Jennings, who was recently, Kelsie Jennings, who was diagnosed with asthma, which recently exacerbated by, that's enough. Okay. So, which exacerbated, don't overcomplicate things. Recently, lately, you have confused yourself there. So, Kelsie Jennings, who was diagnosed with asthma, which exacerbated, or which was exacerbated. So, that is another point. Okay. Upper respiratory infection. So, now here, what you have to see is the case notes now. Now, let us see. Viral upper respiratory infection. So this is assessment. Okay, this is assessment. So this is the latest one. You can write directly this one. You can use this one directly. I don't know why you involved earlier again that one. Okay, right? Now, this is 3011. So this is the beginning. Viral upper respiratory infection. And this assessment was probable asthma. Now, asthma still slightly unstable. Okay, much improved, worsening shortness of breath, and here severe asthma. And this triggered by viral upper respiratory tract infection. So that's it. Fine. So this is what is more important. This is the latest one. So this is the latest one. You can write that one. Okay. So asthma. So triggered by, you could have used which was exacerbated, which was triggered by, you could have used better. Okay. Which asthma was exacerbated. Fine. So triggered by, severe asthma triggered by viral. So which was, okay, exacerbated by, not ordinary one, viral upper respiratory tract infection. Okay, right. So which was exacerbated by an upper respiratory infection. Okay, fine. Is being referred. Okay. So for immediate assessment and appropriate management, immediate assessment, very good, is being referred for immediate assessment. Many people immediately referred or urgently referred or urgent referral, something they say. So be careful. Assessment is immediate, referral is normal. Referral, that's all. Okay. Referral for urgent assessment, that is the meaning, not urgent referral, referral for urgent assessment. Okay. Now, fine. Immediate assessment and appropriate management. Okay, now let us see here. Referral to doctor in the emergency department. Dr. Mole is in the emergency department. So you're sending, so this is an urgent letter. Okay, so present problem is more important. So this is more important. Worsening shortness of breath, seriousness. So write about this one first. Write about this one first. Okay, when you say urgent, so the most recent visit is the most important. Recent visit is the most important, and afterwards you can tell about the other visits. Okay, afterwards you can tell about the other visits. Okay, right, very good. Immediate management and appropriate, immediate assessment and appropriate. So, or emergency evaluation. Okay, right. So, see here once again. So, fine, you are writing a referral letter. Is being referred, very good. is being referred for immediate. This is what I like in you. You have implemented what all suggestions I have given you. Passive voice, okay, and relative pronoun. Everything you are implementing. Okay, fine. Today, a 2 days history, no, 2 day history. A 2 day history of worsening dyspnea and concurrent anorexia with runny nose have been reported. Very good. Very good. Today, a 2 day history of worsening dyspnea and concurrent anorexia with runny nose have been reported. Good, excellent. In addition, accessory respiratory muscle usage, inflamed throat, as well as widespread wheezing on auscultation have been noticed. Good. Have been noticed, more than one. Accessory respiratory muscle usage, inflamed throat. Okay, here you should have said and. Anywhere, one place you should have told and. So as well as is not suitable here. You would have just said and. Because and you have to use either in the place of as well as, you can use and. But if you use as well as here, and you have to use here. So when you are using and, why don't you use it here itself? Why you want to use extra as well as? So that's it. Three things are there. In addition, accessory respiratory muscle usage, number one, inflamed throat, number two, and widespread wheezing. A widespread wheezing? No need. Wheezing. A wheezing? Wheezing. That's all. And widespread wheezing on auscultation have been noticed. Three things. So last one you will use and. But when you say as well as, that means in addition to. Okay. Not only but also. So here if you are using as well as, then here you have to use and. Muscle usage and inflamed throat as well as widespread. So like that. So and you are anyhow you are saying. So why don't you use it here only? So you will save 3 words. Remove 3 words and put 1 word. That's all. Is that clear, Dr. Karim?
Yes, sir.
Okay. So
Yes.
that's it. So you can say as well as, for example, respiratory muscle usage as well as inflamed throat were noticed, as well as you are using. Means similarly. When you are using 2 other things, you have to use and there. It's a must. When you are only using 2 things, you can use as well as. But as well as you are using, it becomes singular. Okay. Right. The previous one you will consider, as well as afterwards you will not consider. Okay. Widespread wheezing have been noticed. Very good. So better use and. Furthermore, don't use the word furthermore. You can say in addition. Furthermore, moreover. Okay. Don't use these 2 words. Furthermore. Okay. So avoid using such words. So avoid. So avoid some words. Okay. Avoid some words. Avoid words. Okay. Avoid some words. What words you can avoid? So furthermore. So furthermore can be avoided. Avoid furthermore. Case notes, okay. Words to avoid. Words to avoid. Reassuring words. Okay. Okay. It is there here. Avoid words which you have to avoid. You can check those words. Okay, fine. Furthermore, moreover. Okay. Furthermore, moreover. These words we can avoid. Okay. So no searching time. Okay. So avoid these words. Furthermore and moreover. So don't use this word. It's redundant. It doesn't help you much. So instead of that one, you can say in addition. In addition, you also already used. Okay. So if right, you can say also. A PEFR of 140 liters per minute has been recorded with only a minor improvement after using the Ventolin nebulizer. Okay. Has been recorded. Fine. During the past few months, Kelsie Jennings has been attending frequently. Okay, initially for suspected upper respiratory infection with the possibility of asthma, which required a short course of paracetamol and fluids. Okay, right. 3 weeks later, at 230 liters per minute PFR, 230 liters per minute PFR was recorded, and lower chest wheezing was heard. At that time, Ventolin 2 puffs thrice daily. Ventolin 2 puffs thrice daily was prescribed. Ventolin was prescribed. Okay. Ventolin was prescribed. Okay. Ventolin 2 puffs thrice daily was prescribed. Okay. And close PEFR monitoring was recommended. Very good. You are doing very nicely, doctor. Consequently, PEFR improvement from, not from. Okay, from 280 liters per minute to 340 liters per minute. Okay, you write one capital letter or small letter. Any one you write. Why are you writing one time capital letter, one time small letter? So better to write. Okay, fine. Capital letter or small letter. Any one you can write. Fine. Was recorded. So improvement was recorded. Okay. As well as was recorded. As well as doesn't suit here. Improvement from as well as doesn't suit here. It is not very fine. So everywhere you are using as well as, something wrong is there. So don't use, better you don't use as well as. So how you have to do? Drinking as well as smoking. Drinking as well as smoking is harmful to health. Okay. Drinking and smoking are harmful to health. Drinking as well as smoking is harmful to health. So be careful when you are using as well as. As well as should be used to join two similar things. Okay, two similar things. Okay. So here you have no other option than using and. Okay, or you can use whereas. Okay, otherwise you can put a full stop and start a new sentence. And an increase of exercise tolerance, increase of exercise tolerance or increase in exercise tolerance. And exercise tolerance, increase of exercise tolerance and symptoms resolution or the subsequent, okay. Increased exercise tolerance. Okay, increased exercise tolerance. That's enough. And symptoms resolution or the subsequent visits were reported. Okay, so two things are there: increased extra tolerance and symptoms resolution. So this also increased. So both are there. Then you have to say increased, an increase in exercise tolerance and symptoms resolution over the subsequent visits was reported. Okay, an increase in, okay, you can say like that also. Okay, and an increase in exercise tolerance and symptoms resolution was reported. Increase was reported. Okay, an increase in exercise tolerance and symptoms resolution over the subsequent visits was reported. So increase was reported. Okay. Please note, Bicotide 200 mg 2 puffs 3 times daily was commenced. So why do you want to say please note? I don't think it is using. So other things are not noteworthy. Only this is very important, and other things are not noteworthy. Ordinary things. So only this one he has to note. So that means only this is highlighted and the others are diminished. So everything is important. So everything is to be noted. That's why you are writing. Okay. Fine. So please note. Okay, fine. Bicotide 200 mg, 2 puffs, 3 times daily. 3 times can be written as thrice. Thrice. This is correct only. I'm not saying it is wrong. Or you can say, okay, we'll put it in brackets. We'll put it in brackets and say thrice. I'm not saying it is wrong. Thrice daily was commenced. Bicotide was commenced. Okay, Bicotide 200 mg, 2 puffs, thrice daily was commenced. Okay. Fine. Based on the aforementioned circumstances, further evaluation and appropriate management would be profoundly beneficial for enhancing Jennings condition. Okay. So urgent assessment. Further evaluation and appropriate management. So appropriate management is already used here. So you can use something else. You have improved a lot improvement is I can notice. Really, I appreciate. Okay. Fine. So again, appropriate management. So necessary follow-up or something like that. Change whatever you want. So you can change this one because it is repeated. Avoid repetition. There is no meaning in repeating the same thing. At least modify that one. Okay. And necessary treatment. And necessary treatment would be profoundly beneficial for enhancing Jennings condition. Okay, afterwards already S is there, so no need to put another S. Last S is there, it's already an S. So another S is not needed. Just put apostrophe and leave it. Otherwise it will become a hissing sound. Jennings, like that. So Jennings condition, finished. Okay, S is already there. So treat that itself and put an apostrophe, Jennings condition. In case any additional information is required, please do not hesitate to contact me. This will not be counted. These words will not be counted. Okay, fine. That's very clear. Right. So now what is this Bicotide? You have written bicotide. So what is this bicotide? Can you tell me, Dr. Karim, what is bicotide? What is this bicotide? Unmute, please.
Yes, sir. Do you hear me?
What is this bicotide?
It's like a corticosteroids inhaler.
Does it have any special generic name?
It's the generic name. It's
So bicotide, any specific name
because
is there? For example, like antihypertensives, like that one, or steroids, or anything like that. What is this bicotide actually?
corticosteroids inhaler.
Yes, you
Inhale.
got it. So you have to go through that one now. So bicotide. Yeah, see here. Bicotide is corticosteroid. Okay, you could have used this word corticosteroid. Okay, so before that one, you could have introduced. Okay, bicotide was commenced. Okay, so inhaled corticosteroid bicotide was commenced. That's it. Okay, you could have used this one to make it more powerful. Okay, then next one. Then what else you can see? Deterioration. So you can say here deterioration. So see, condition went down. Urgent assessment is required at hospital. Urgent assessment is required at hospital.
Yeah.
So why? Because of the deteriorated condition. So condition went very bad. Okay, unstable assessment. Okay, now here much improved minimal nocturnal exercise. Okay, now here worsening shortness of breath, worsening condition, so deterioration. Okay, then loss of appetite, red throat, ears normal, difficulty in breathing, axillary muscles, chest oscillation. Okay, all these things. So now you can see the condition deteriorated. Okay, worsening condition was noticed. Worsening condition has been noticed. That's what you have to write. So worsening condition. You can say worsening, worsening condition, or you can say you can also say worsening condition. This word worsening. So instead of that one, you can say a better word, deterioration. 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 Okay. So significant deterioration, you can say. Tremendous, drastic deterioration was noticed. Drastic deterioration or significant deterioration. Significant deterioration was noticed, was observed. Was noticed. Anyone you can say worsening condition was observed. Is that clear?
Yes, sir.
You could have added this one there, right?
Yeah.
Huh?
Yes.
So worsening condition was noticed, and therefore, okay, based on the aforementioned condition, means this is the condition. Okay, this you could have written in the previous last but one paragraph. Okay, or in the emergency first paragraph, you could have written here worsening dyspnea. Here you could have added somewhere here. Okay, significant deterioration. Okay, here you can say significant deterioration in her condition was noticed. Okay, so this is it. So you could have added there. What you could have added? Significant deterioration, okay, was noticed. So I'm just putting it back in the brackets. However you want to, wherever you want to add, you can add. So wherever you want to add, you can add this one. Significant deterioration was noticed. That is what, okay, you could have added there in the passive. Okay, so right. Significant, right. Significant deterioration of asthma was noticed, or whatever point. Now let us see here. Worsening shortness of breath, okay. Severe asthma, that is what it says. Fine. Minor improvement, with only a minor improvement after using Ventolin nebulizer resulted in minimal relief. Ventolin nebulizer, okay, provided minor relief, improvement in the condition, minor improvement in the condition, but relief, okay. So has been recorded with only, so using, after using the, whereas you can say record, whereas Ventolin nebulizer, okay, Ventolin nebulizer provided, okay, or minimum relief, okay, slight relief was provided with by Ventolin nebulizer. That's it. So the usage of Ventolin nebulizer. So next, whatever it is, was recorded, and here you can put a comma here. Was recorded in lower chest was heard. Okay, fine. There's a big phrase like. Fine. So now, how do you feel the feedback, Mr.
Yeah, thank you so much. Thank you so much. I appreciate your
Yeah,
feedback.
Karim.
That will work. Yeah. Good. Yeah, that's good. That's good.
So a lot of
I really
improvement
like.
is there,
Yeah.
definitely good.
Yeah.
So you are using the passive
Yes,
structures. Definitely, if you use, you will cross 400. Definitely, like many other students, you will also cross that. Okay, fine. Any doubts you have, you can ask me now.
No, no. Thank you so much. I appreciate it.
So, okay. Anything else important you missed? Minimal nocturnal. No, persistent nocturnal cough. Patient returns with persistent runny nose and fever. Resolved. Persistent nocturnal cough. Okay. Yeah, that's fine. That's fine. Many things you have added. Okay. That will not make a big difference. Okay, fine. Okay, then. Yeah. Tell me your points. What did you learn today?
Especially
yes,
introduction.
Dr. Karim.
Yeah, especially in the introduction to about the misconception about lately, recently, not use it. And yeah.
Okay.
Passive voice. That's all I think. Yeah, I will work on it. I will work on this comment feedback. And if I have any question, I will ask you that.
Okay.
Thank you so
Right.
much. Thank you so much.
So here,
Yeah.
when you are first introducing this acronym PEFR or abbreviation, whatever you say, first time you have to write in full.
Um.
And next time you can write a small PEFR. Okay.
Yes. Yes.
What is that? Peak expiratory
Yeah.
flow rate, right?
Flow rate. Yeah. Big experience.
So that you have to write here. This first time you have to put this in brackets. 1 minute. First time you have to put this in brackets. And then, so you should prove that you know this word, okay?
Yes.
So here you can say peak in small letters, X. Okay. So you can write it full. Peak exhibitory. What is that?
The expiratory.
Expiratory. Once again.
Expiratory.
Here itself. Peak expiratory flow rate. Okay. Flow rate. Is that clear now?
Yes.
So you have to write it here. It is already given there. So that same thing you can write here. Peak expiratory flow rate. This one. Okay.
Yeah.
So then you have to put in brackets. Afterwards, you can write PEFR. See, same like this. Here also in the case notes, you can see PEFR many times maybe. But only first time you have to write full. Okay. So that others can understand.
Yes.
Is that clear?
Yes.
Any
Clear.
abbreviation you get
Yes.
first time you write in full. So that to prove that you have knowledge regarding that. Okay.
Okay, sir.
Okay, fine. That's very clear. Okay. So we'll meet tomorrow with another correction, 1 or 2 corrections I'll do for you tomorrow. Okay.
Okay.